Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today we travel to the state of Cantabria, Spain for an interview with Dr. Paloma Navas, Director General for Public Health. Thanks in large measure to the work of Dr. Navas and her colleagues, Cantabria has seen fewer cases and deaths than surrounding areas of Spain, but it has not been easy. Let's listen. Dr. Navas, thank you so much for joining me. Could you start by telling us a little bit about Cantabria and your position there?
So right now I'm Director General for Public Health in Cantabria. Cantabria is a state in northern Spain. Beautiful. So as soon as this ends, you should all come to visit. And my role here is to make sure the public health system works properly for the region. So I'm taking care of not only COVID, but water sanitation, vaccinations, cancer screening, and so on.
And you've been in that position since when?
I got in this position last September. So just a few months before this crisis started.
So what was it like to be new in a position responsible for health in this area? How many people live in Cantabria?
So we are a little bit less than 600,000 people. It's a small region. And it was actually really tough. It was very difficult for to be able to react so fast to this crisis. After just a few months, I was able to have a really great team, and that was crucial for me. Like the team, when I asked for people to work later, to work in the weekends, people reacted really amazingly, and that was the strength that we were able to pull out in this situation.
Now, I know that certain parts of Spain, particularly the urban areas, have had just a terrible time with the pandemic. What has the pandemic been like in Cantabria?
So we actually have had, we have been very, I don't know if to say lucky, but we have had a good situation. Like our healthcare system never collapsed in these times, which is great, which is a success. We had our mortality rate is one of the lowest of the country, which is another really good sign. And even our zero prevalence hasn't been as high as other neighbor regions. So situation here was difficult as everywhere else. But thinking about the disease, we haven't had as much cases or as much difficult cases than in other regions. And we have been able to keep doing our surgeries and all of our health care, right? So that has been really, really, really great here.
Tell me what the major components of your response to the pandemic have been in Cantabria.
So the major components have been first to have this regulation of how to help the public understand that they have to wear masks. It's mandatory in the entire country, and in Cantabria we made it mandatory in the summer. You have to wear a mask every time you're in public. We also made these regulations against smoking in public places. So now it's harder to smoke. We want to prevent people from smoking next to other people. So you cannot smoke in the beach here.
Was the smoking regulation about COVID too?
Yeah.
Help me understand the connection.
Because if we say that wearing a mask is mandatory, and except when you have an activity that makes it impossible, smoking would be an activity that makes it impossible. So some people would be like carrying a cigarette in their lips around without wearing a mask. So we said, you know what, smoking is not an excuse for not using the mask. And also we were scared that if you are exhaling strongly, right? As forced exhalation, as you do when you smoke, you can propel your aerosols and your sludge droplets farther. So we said, okay, now you need to have like a safety area around you. And if you want to smoke, that's great, but you have to do it by yourself and make sure that you are not infecting other people. Also, from a like occupational health perspective, we had many outbreaks because people would do like a smoking pause together, and then we will have an outbreak right there. So smoking had a lot to do with us, with the outbreaks and with the transmission of the disease.
In addition to the rules that you put into place for mask wearing and smoking, I'm wondering about other things that you've done to address COVID. For example, are you doing contact tracing?
Yeah, we are actually doing a very profound contact tracing. Like we go back up to 7 days from the day you start with symptoms or the day you are diagnosed. The national protocol goes back 2 days, but we decided to make it longer because we believe that we don't want to see only who you were able to infect, but also who might have infected you, right, in the past. So going back those days allowed us to identify maybe social gatherings, trainings, and moments that were actually very sensitive. And we evaluated our contact tracing system, and we saw that we were able to find 37% of positives among those gatherings, right? So it helped us realize that 2 days were not enough. And actually, this system, in the last national review, it was shown that we were able to identify nearly 95% of the cases. Like there is actually nearly no difference between the real cases or diagnosed cases in Cantabria. So that's actually amazing.
So just so I understand, usually a contact tracing program is focused on who the patient might have given COVID to in the previous 2 days while they were still infectious. But you're asking about contacts up to 7 days before, did you say? Or 5 days before?
Yeah. 7 days before.
And so by doing that, you're not trying to find necessarily who they might have given it to because they weren't infectious then. You're trying to find where they got the infection. And you learned where people were giving each other COVID, the kinds of settings.
Exactly.
And where did you find, where were people giving each other COVID most likely?
We social gatherings are for us a really high risk moment. And social gatherings while eating is crucial. Like we found that they had 3 times more risk of being positive of COVID if you had this if you visit like a restaurant than if you hadn't. But we also had found like outbreaks in training, like in sports training, even in funeral. We have had a couple of bad outbreaks from funerals, which are very sensitive moments for people.
Mm-hmm. So has that led you to put in place new policies? Like are your bars and restaurants open now?
No, they are not open. We have all of the interiors of the bar and restaurants in Cantabria have been closed since the peak of the second wave, like last month. It has been really painful because, as you know, Spain is really, our economy is based in tourism. So like all of the, this part of the economy is crucial for us, but we closed the interiors and we allow people to gather outside in the terrace, in the open areas, outdoor dining and outdoor, which is a bit different for our culture because in the winter, nobody actually used those outdoor eating places, but now they are using them. So they are able to make money and to survive and to keep going. And our rates are actually in a good situation.
Got it. And what have been some of the hardest moments for you during this crisis?
Well, many moments, many moments. Since the last few months, I haven't had like quality time with my family. I haven't had like a fully peaceful moment, few peaceful moments. I remember well when our first wave hit us, we had to lock down. Cantabria was like the second state in the country that locked down before the national lockdown. So we were really ahead and fast to react. That was really tough. And I remember when we ran out of PCR, and we had to make sure that PCRs are protected in hospitals, and making that decision that only like really difficult cases are going to be tested and mild cases are not going to be tested. That was really, really difficult moment for me, for many days, actually.
How big is your team at the health department there?
So my team is it's big. Depends on how you see it. Like I have, in theory, I should have a double amount of people, but in reality, I have 50% of the department is filled with people. I was able to double the amount of contact tracers that we have now. And in total, I might have like 140 people, something like that. But they have their own task. Like they are not all of them are COVID centered. Like they do all of the inspections and all of the public health jobs.
And have they been working pretty hard like you since the beginning?
Yeah, my team has had an amazing response, and we turned our department from public health. It became a COVID department from the very beginning. Like we actually changed the space. We had an outbreak. We had a COVID outbreak in the building, in our department, which was also another difficult moment for me because some people of my team got really sick, and that was really tough. And all of them were doing contact tracing. Everyone was doing COVID things. And then slowly we were able to recover our activity and bring more people to the department who will be focusing in contact tracing and COVID response, and allow people from other departments to catch up, right? Like cancer screening, breast cancer screening, or water sanitation, or so on. So I would like to have more people. I think public health departments are really small.
How do you keep your team motivated during this difficult time?
Well, I just walked around the building with chocolates, with a Christmas hat.
And a mask.
And a mask, of course. So I try to keep them motivated. I tell them often that you are not in the pictures, you are not wearing a white coat, people might not identify you, but you are saving lives, and you are saving a ton of lives. So I try to remind them that this effort is worth it, that we are saving a lot of lives. Our mortality rate in Cantabria is really low, so we actually did a good job. But then I also try to listen to them, and if I see someone who is having a bad time or a difficult time, we spend time together, and I try to find resources, like to connect people with mental health experts if they need it, to give free days if they need it. I try to do my best, but I have also learned a lot of how to be with them, you know.
How do you think about the vaccine now? Do you see light in the future? Do you see promise? What do you think the vaccine is going to be able to do?
I think for us, the vaccine will help in the home care settings a lot, because older people who live in home care settings are very vulnerable, are quite vulnerable, and we have had outbreaks. So I hope that with the vaccine, we are going to lower and to control those outbreaks, to prevent these outbreaks, and that will help us keep fighting with the COVID while more people are getting vaccinated, because our hospitalization will be lower. Also, I think that people are excited and they see light in the tunnel, and that's very important, because I'm really concerned about the mental health crisis that we are having and we are going to see soon. So I'm excited about that, and I just don't want people to be over happy or too happy with the vaccine, because we still have a long year to go.
Mm-hmm. Well, I wish you the best for this year, and I really appreciate your taking some time. You really achieved some remarkable progress in Cantabria. Thank you for joining me.
Thank you so much, Josh.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.